onto some really shitty news, some really depressing and disappointing, just heartbreaking news. Okay, I think of nurses as angels. I think of nurses as heroes. The reason I made this channel is because I love being a nurse, and I think what we do is special and is super. It's necessary. It's needed. It's important. It's all of the above. But when you abuse the power that comes with being a nurse, you ruin it. You ruin it for all of us. You put the fear of trusting a nurse in the public, and it's scary, and it's the worst thing ever, and I hate it. And this is one of the stories that a man has abused what it means to be a nurse in ways you can't even describe, in the worst way possible. A nurse in Phoenix was charged with sexual assault of a woman in a vegetative state who gave birth. So not only did this insane nurse rape and sexually assault a vegetative patient, a patient that was brain dead, in a coma, not only did he rape and sexually assault her, it got to the point where she was pregnant and had a child. What in the world why? How? I don't understand. Let me tell you the background before I start screaming and yelling and ripping my eyeballs out, all right? A nurse at a Phoenix nursing home who had been assigned to care for a woman in a vegetative state who was raped and later gave birth to a child was charged on Wednesday, this past Wednesday, with sexual assault. So Phoenix Police Department took the nurse, Nathan Sutherland, and I'll show you a picture of the horrific, disgusting man that did this, who was 36 years old, in for questioning in the case on Tuesday, the police said, and collected a DNA sample from him that matched that of the child, a boy who was born on December 29th. Mr. Sutherland, a licensed practical nurse, had worked at Hacienda since 2012 and was assigned to a unit treating intellectually disabled people since 2014. The company said in a statement on Wednesday he was fired immediately after the company learned of his arrest. Before I add my 2 cents to this conversation, I do want to add that the two doctors who treated patients at Hacienda, including the woman at the center of the case, no longer work at the nursing home. I think it's important that we talk about the whole team and not just Nathan Sutherland. Yes, I'll get to him because he's just the worst of the worst, and yes, he could have done the sexual assault or rape with the whole team being perfect caregivers. But I find it really difficult to just let the rest of the team off the hook, and obviously they didn't. Those two doctors who were at the center of the care, who took care of the patient, obviously were let go because there are signs and symptoms to having a pregnancy. I don't know the specific details of how she went through the pregnancy. I don't know if because she was in a vegetative state, the pregnancy was very different. But we do know that the baby boy was born and is in good condition. He's healthy. That is the current situation of the baby boy, so he obviously developed perfectly fine. I'm guessing she had all of the signs and symptoms of a pregnant woman. So, do I want to put all the blame on Nathan Sutherland? Of course I do. He is the monster. He's the goddamn monster. But as the rest of the care team, we could have done other things to make sure it didn't get to the point where on the day of the birth is when the care people, the nurses, the staff at Hacienda called 911 saying, oh my goodness, this patient is giving birth to a baby boy and she's in a bad condition. And that's literally what happened. The day of the birth is the first time anyone noticed that she was pregnant. And that's how it got to that point. Now, going back to Nathan, you are a disgusting human being. It kills me inside because we now know that he worked at Hacienda and he took care of patients who were disabled and had mental disabilities since 2012. It's 2008, so he was fired obviously 2018. That's 6 years where he was involved with these patients, taking care of these patients day in and day out. Obviously had hours, tons of time one-on-one with these patients. What is to say he hasn't done the same exact thing to his other patients, to hundreds, to tens, whoever knows? Even if this lady is the only patient he did it to, I'm not saying I'm just saying, just thinking, going back and trying to wrap your head around a human being that would do that to a patient that's in a vegetative state. They obviously have no moral standards at all. It's the craziest thing. It's just the worst. It's just the worst. And like I say, there's a responsibility that comes with being a nurse. There is a trust that the population, that the patient, that all of the people around us, that your community puts in you as a nurse. You are taking care of their health, the most personal thing, the only thing we have to ourselves that we can honestly say is ours is our human body. And this man ripped that trust from the patient, from the family, from the community. It's a horrific subject. It's a sad story. And everyone's talking about Nathan and how disgusting he is. And I just went on the full rant about that. Everyone's talking about the other healthcare caretakers and how all of this happened. But the question of the day is, the most important question here is, what is going to happen to that baby boy? What is going to happen to this boy that knows that his father, his biological father, is a rapist, and knows that his mother is in a vegetative state, will never know anything about his mother? That's the question. What is going to happen with the baby boy? The last report, there wasn't too much about him in the articles that I read, but he is in a healthy, good condition. Hopefully he goes, a wonderful family will take him in. Hopefully the family of the patient will take him in. Something, but that's the question I want to know. That's what I want to know. What is happening to the baby boy? I hate talking about these stories, but I think it's super important that we do, because I believe that 99.9999 forever percent of nurses are amazing human beings, and that's why I talk about us in such good light and I'm so proud to be a nurse. But that very tiny percentage of nurses that take advantage of the position that they have we, as the rest of the nursing community, needs to yell and scream at the top of our lungs saying that is absolutely not wrong. We do not stand with nurses that do things like that. We are the furthest thing away from human beings like that, and we want them out of the profession and put in a cell and locked away for as long as necessary. The fact that he's a male nurse, it just makes everything, it's horrendous. It's just worse. I mean, there's a reason, ladies and gentlemen. It's not just out of the blue that the majority of times a patient says, I don't feel comfortable with this nurse, is a female patient with a male nurse. That's not an accident. That's just not something that just happens. It's because of the culture we live in. And these kind of stories, these kind of human beings do not help the situation, obviously. Obviously, I said 99 point whatever our nurses are great, and that includes the male nurses in the community. But I'm saying when stories like this happen, you can't blame a patient when they don't want to be taken care of by a male nurse. You can't get upset. You can't feel some type of way. It has nothing to do with you, but these people, these kind of nurses, these male nurses make it hard for us, the rest of the male nurses that are doing our jobs, just trying to be as good a nurse as we possibly can to all of the patients we have. I'm done. I'm sorry. These stories, they just kill me. They kill me because I love what I do, and they bring out the worst of what can happen if you give nurses the power, the autonomy, all of these things. I hate it. I hate it. But I'm happy that everything's taken care of, and I'm hoping for the best for this baby boy. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.